A couple of days back, a 21-year-old girl walked into my clinic asking for aligner treatment. We discussed her case, took some x rays, explained her the treatment, the duration, the cost involved, and she agreed for the treatment and gave us a token money to proceed. So we did the prep, the teeth cleaning, took more detailed records, photographs, did the treatment planning, took the digital scan, and the next day she and her mother called me up and said that they have found a better price at some other clinic and they want a refund. Fair enough. Everyone should be allowed to choose a doctor that they can trust. So we told them that there was some cost involved in the procedures that we did. We will deduct that cost and refund you the rest of the amount. To which the mother said, आपने अभी तक किया ही क्या है जिसका चार्ज करोगे? I didn't argue any further. I gave them a full refund, didn't keep any penny whatsoever. But that question has stayed with me ever since. किया ही क्या है आपने? What have you done so far? I hadn't just taken an x-ray. I had looked for hidden infections, bone levels, impacted teeth, root positions, things that only a dentist can see. I hadn't just taken photographs. I had documented the starting point of all future tooth movement. I hadn't just done a scan. I had made a three-dimensional map of her mouth accurate to fractions of a millimeter. Because if that map is wrong, every aligner that follows will be wrong. People often think they're paying for just plastic aligners, but they are not. They are paying for the decisions that decide where every single tooth is allowed to move. They are paying for someone who can say, yes, this can be done. And more importantly, someone who can say, no, this isn't possible with aligners. Look, the scanner costs money. The sterilization, equipment, training, software, everything costs money. But the most expensive thing in this room is not any machine. It's the years it took to learn how to use them without harming someone. Questions like these, they sting. They stay with us longer than most people realize. But 5 minutes later, another patient walks in and they deserve the same amount of care, the same attention, and the same patience. And so we start again.